to our concepts and topics that are very relevant na of integration of technology and at the same time our profession. When it comes to the nursing informatics, there are three fundamental components of informatics. We have the processes, the people, and the technology. If we say processes, uh, these are these are considerations on how the informatics concept will translate data or apply data into relevant, useful, and meaningful information. So that's why there are three fundamental components of informatics. The people who are or who is competent, skilled, the available platform, internet connectivity, uh, available resources of the facilities. The processes itself is on how the people who are skilled use the technology, the platform, and process this information from data, information to knowledge. So that's why these basic components may have the significant application on how it will translate specific data to relevant, useful, and meaningful information. If we say relevant information, the data that is converted into information that are relevant is the outcomes of which it will be useful towards quality. Okay. Now, if we say application of data that can lead or direct that the data will be translated or converted into useful information. Useful is how it will benefit the stakeholders. Next, meaningful, uh, the data will be considered as a meaningful information if this will contribute to everyone. It will contribute to everyone's development, from the operation of the hospital to the people development, for the enhancement of the processes. So that makes meaningful. Okay. So with it comes to when it comes to the three fundamental components, specifically on nursing informatics, the people that we are referring are nurses. Then the technology that we referred is information technology, and the processes are the healthcare processes. So obviously the nurses are the ones that are being considered as the manpower. Then we have the information technology as using the information science, the technology combined on specific parameters such as the use of the available resources and platforms. And the healthcare processes are those that have been identified into specific operations on how it will translate uh, data information to specific knowledge. Just like, for example, one of the example of healthcare processes is when the client is being admitted to the hospital. What's the process upon admission? When the client had been hospitalized in the institution, what is the process specifically upon admission? When the client will be subject for diagnostic examination, what healthcare processes are involved? So in this perspective, it goes back to the nurses on how they will use this information technology and process the healthcare, which the core specifically are related on the patient care and clinical data. So these are the two that are very significant on the role of nurses, because we are oriented on how to do the documentation and at the same time in the patient care. So how it will translate into relevant information, just like how it will be translated to the access to the information to have an efficient nursing care management, how it will be useful. So how the stakeholders, the clients, will benefit from the use of the three fundamental components, and how it will become meaningful, so that the hospital and the stakeholders, even the manpower or employees, will benefit or use it in their profession for personal and professional development. Now, Now, when according to the American Nurses Association, the nursing informatics are considered as nursing science, analytical science, and information sciences. Okay, so we have considered nursing as a science because the basic principle that we are using here as science is a systematic way on how to process information. So just like for nurses, we are using nursing process, and it's a science by which we do assessment, we have the diagnosis, planning, intervention, and evaluation. So it's part of how you systematize the basic data into information and at the same time with the expected outcomes. Information sciences, it is a systematic way of how you will use information that will benefit the client, the nurse, and the hospital. The analytical sciences are a systematic way on how you have used the concept of your responsibilities as nurse in patient care, and information sciences is those that you have gathered when it comes to the nursing process from nursing science will be useful and analyzed to set quality care management for the patient. So there are four aspects in the nursing informatics in relation to the nursing science, information sciences, and analytical sciences. It can basically identify, define, manage, and communicate. With these three components in nursing informatics, it can identify the direction, define, it can it can specifically give meaning, then manage, it can give you direction, communicate, it can relate. Okay, it can relate to others, and you may have a unified uh, interpretation of data. So this is identify, define, manage, and communicate. So that's why as it considers the processing of data, information, knowledge, and wisdom, the nursing science, information science, and analytical science are a combined concepts so that to facilitate data, information, knowledge, and it becomes wisdom. Why, sir, you have included wisdom at the top? Because the wisdom could be used as a way of clinical decision making already. Kasi you may have the knowledge but you have not utilized it for decision making for the benefit of yourself as a nurse and benefit of the client in care management. It becomes a wisdom because it's a power. It's considered as a power that you have, by which the wisdom that you have can be shared. The wisdom that you can have can benefit the client and can benefit the whole nursing service. So that's why it is part of the nursing practice. Now, to expound more nursing informatics from the concept of nursing science, analytical science, information science, and the concept of data, information, knowledge, and wisdom, how it is related to decision making. That's why I have even mentioned that on the top, we have considered the wisdom as on the peak of our hierarchy. So this wisdom may give information on the structures, processes, technology. So just the same as that from the term that we have discussed about nursing science, information science, and analytical science, once it turned into a wisdom, that's why I have mentioned that the wisdom can be used as for the decision making, and if it comes to a point that it could be utilized as for decision making, these are now information that can be used as standards. Okay, that's why there is some information that it becomes a wisdom, it becomes it considered as it will be considered as standard, it could be considered as reference, if it can be considered as the three that we have mentioned: relevant, useful, and meaningful information. So that's why when it comes to the structures are referring specifically on how it will facilitate. Okay, it will facilitate on how the organization will use this for decision making. Processes on how this information can be used on the role of nurses and the role of the hospital personnel. And when it comes to the technology, the available technology can use the process, can use the concept of this information as for specific and individual client, and can be used with colleagues, and can be used by the whole hospital for the operation. So that's why the beneficiaries are the nurses, patients, interdisciplinary team, so the healthcare team, the consumers, the stakeholders, and that leads to desired outcomes. So these are the concepts of, this is the concept on how how American Nurses Association presented nursing informatics. Now, as nursing informatics as a nursing specialty, we have mentioned and discussed in our previous discussion that nursing informatics may now have or are now embedded into a subspecial specialization or a specialization of nursing uh, as a profession. So as according to the nursing informatics as a nursing specialty in 1992, the American Nurses Association considered po nursing informatics as a specialty. And this is always this was guided by nursing informatics on scope and standards of practice, and there is a board certification offered by the American Nurses Credentialing Center. In our present situation, we still have the Senate bill that are being proposed to supposedly be enacted as a Philippine Nursing Act. And this will cover already the advanced practice nursing. And I think if this will pursue here in the Philippines, nursing informatics can be considered as a specialization. And if the Professional Regulation Commission through the Professional Regulatory Board of Nursing will consider this career progression, then it may tap specifically or consider specifically the specialty organization who can be considered as a credentialing organization for its certification. So this could be this is in progress. This was in progress when it comes to establishing the pathway. We have already conceptualized, but with the supposed law and be enacted into Philippine Nursing Act, so we're getting towards on that direction. Now, the roles of nurse informatics specialists or informatic nurses. There are 6. We have education and training, systems maintenance, clinical information, systems implementations. We have data analysis, reporting, systems optimization, and we have collaboration and leadership. So let us discuss one by one. So the center or the core of these roles are the informatics nurse, which the nursing informatics is considered as a specialization or a specialty. And this specialty or specialization will be recognized and certified by an organization or a credentialing center. So it may depend on how it could be set up here in the Philippines. So when it comes to the education and training, the focus of the education and training is to assess the competencies, the skills, so that it could be translated on how it will develop their professional skills in nursing informatics. Just like we have mentioned that we do have the chief nursing information officer, the CNIO, or the chief nursing information officer in a specific institution to facilitate the monitoring of the needs of the nurses when it comes to education. So that's one role. Systems maintenance. We may not just only focus on the care management, but since we are oriented already on the use of the technology, the systems maintenance is needed on how to upgrade the use of technology, because we all know for a fact in even in 24 hours in a week, there are many technological products that are being released in an online platform or in an e-commerce system. So that's why the systems maintenance could be one of the role of the nursing informatics specialist, simply this could be very essential for the upgrading. Second is to be aware of the trends and if it could be adapted into the operations of the hospitals or the healthcare facilities. When it comes to the clinical information systems implementation, clinical information could be associated with the evidence-based practice because any information that you may need and will connect it to the care management of individualized care management, then this clinical information systems implementation is possibly the access of the healthcare professionals, the nurses also. When it comes to the important information that can be useful, relevant, and meaningful on the perspective of the nurse when it comes to the application to the nursing care management of the clients. While when we talk about data analysis and reporting, it is connected with the clinical information. If you wish to identify from the time that the client had been admitted in the hospital and from the time that the client had been discharged, each client in the hospital, even with the same diagnosis, may have different ways or various ways on how they cope with the specific diagnosis. So probably with this analysis, it may probably depending on demographics. It could be probably depending on the response of the client to medications, or probably the client demographic may have comorbidities, because these are the factors that can be useful whenever you will encounter the same type of client with the similar diagnosis, and this could be adopted as based from the data analysis and reporting that you have in the hospital. Another is if, for example, the client had the previous hospitalization. So those information can be used if the client had the second hospitalization, which is similar from the first hospitalization diagnosis. So this may give us data analysis on the previous results of diagnostic examination in comparison with the present examination results. So the data analysis and reporting could be one of the roles of the nurse, the informatics nurse. Systems optimization, if you say optimum, it is the use to maximize the resources and the systems available in the institution. It's different from systems maintenance because the systems maintenance is you will upgrade the system on how you will become efficient. If you say systems optimization is how you will maximize the system towards the attainment of the quality. So these are two different concepts, but they are connected with each other. So for example, if a nurse will consider specifically the available resources, if the involvement of nurses are identified, and it may also consider the non-health personnel, then these concepts or this platform can be useful to the other departments because the operation itself is identified. So as much as from the perspective that the client has been admitted, the role of the admissions department may contribute to that. They're considered as the non-health personnel. The billing could also be involved in the system when it comes to the processing of information for the PhilHealth, for the SSS claims. So those are systems optimization. This may not only consider the role of nurses, but the role of informatics nurse to make a realization that the every employees in the hospital may benefit from it. Collaboration and leadership. So informatics nurse is the one that may lead to motivation of our employees and the stakeholders to embrace change, to embrace the transition of systems from traditional to use of the technological advancement until this transition may introduce again another systems that could benefit the hospital or the facility. So these are the 6 roles of the nurse informatics specialist. Now, When it comes to the nursing informatics competencies for all practicing nurses, uh, we have the two columns referring to whys and the what. So according to the American Nurses Association, um, nursing informatics competencies, you need to have advancement of technologies in healthcare. Why have acquisition of nursing informatics competencies? Because as based from the research, 95% of hospitals and 80% of physician offices already adopted electronic health records or EHR. So what competencies can meet this trend? Okay, basic computer competencies. If you are knowledgeable on how to use applications for both hardware and software applications, how to process information through electronic communication, and basic knowledge on the use of the internet and online sources. So these are the basic computer competencies. When it comes to the nursing informatics competencies as a practicing nurse, one of the trends is its significant impact on nursing practice. So we all know that even here in the Philippines, we have estimated of 968,000 nurses here in the Philippines as of February 28, 2022. So what is the significant impact in the nursing practice? Because nurses are the ones that are being deployed even in the communities, and they deserve to be trained when it comes to the information literacy. We are the ones who are facing the clients in the communities to the specialty hospitals and systems of healthcare is not possible without the existence of nurses. So that's why we are considering the basic competencies on information literacy on a perspective that a nurse must know how to access information and how to evaluate if ever there are information that may need further interventions when it comes to storage, protection, access. So these are basic competencies by which the nurse must do troubleshooting. And if we are talking about uh, electronic health records related standards and regulations, the basic guidelines on how to process this information based from the system of the hospital or the institution. Nowadays, nursing informatics as part of the competencies are being part of the regulatory requirements. So that's why if this will pursue, it will be considered as a specialization. But in the US, it's already considered as a specialty and a specialization as according to American Nurses Association way back 1992. So it's very important to consider because we have promoting interoperability. So we have mentioned about before yung sinasabi natin interoperability standards. If you say interoperability standards, these are referring to the exchange of information from one person to another person, even not on a physical mode. It could be through the electronic, it could be a remote. So that's why there are clinical quality measures that may still consider on a perspective on how this program can be improved. Now, on the other hand, this may be considered as part of the competencies on information management. So since most of the hospitals, 80% of the physician offices are using already the electronic health records, then the basic information management as part of the competencies is the use of the electronic health records, the platforms that are available for healthcare technologies such as hospital information system. Here in the Philippines, we have already the Data Protection, Data Privacy Act on how to promote the protection, security, privacy, and confidentiality. So that's why in nursing informatics, it is very important that the use of the three concepts, the fundamental concepts of nursing science, information science, and the computer science are very relevant. So that's why it always associates with science because it concerns with the systematic way on how it will process. That's why it is considered as a science in nursing because we have the the way and the responsibilities on how to manage implementation of specific standards using the nursing process. And the nursing process is a systematic approach. So in this situation, the nursing science are being used as a branch of science. At the same time, this is on how to consider the profession in relation to the implementation of roles and responsibilities with the principles and applications. While the information science, that's why ano na when we talk about science, it is considered as investigation. That's why when you encountered, even remember those concepts of science during your high school or even in elementary, it always embed the laboratory when it comes to experimentation, because it's a way on how you will process data, information into knowledge. So that's why you need to do investigation. And this investigation could be governed specifically on how this information can be accessed and can be used. And this is through the information science. Now, the information science is considered as a body of knowledge, and this is a way on how it will process information on how to collect, organize, storage, how to retrieve, interpret. It could be processed and utilize the information. And we are aware that with the use of the technology, information science is very much relevant, because even in your own mobile phones, you can store information in your own personal computers. It can store information by which you have been oriented with the CPUs. And how about for the mobile phones? Because we do have the SIM card, the memory of the phone. So this is very capable of having the storage and collection of information. Nowadays, we are using the Google survey as a platform on how to gather information. Just like unlike before, we need to do personal interview to the client, have the client process the manual available forms. So I think the information science have already evolved, by which computer science are introduced in the process. That's why it evolved before the courses that are being offered here in the Philippines. We have the Bachelor of Science in Information Technology and the Bachelor of Science in Computer Science. The difference of the two is when it comes to the information technology is how the information will be used on a particular perspective of available technology. While in the computer science, this is on how it will systematically identify the processing of information, the collection, the storage, the retrieval, the processes. But if it will combine information science and the computer science, this on how it will guide you on a process flow, how it will guide you to do the storage, but using the technology. That's why use of algorithms is one way to basically interpret computer science. Now, as we combine nursing informatics, integration of nursing science, computer science, and information science, this is on how it will translate data, information, and knowledge, and as well as wisdom in nursing practice. So this is the combined hierarchy from data until it is considered as a wisdom and will be considered as a standard of the practice in nursing. So I think that will end up my discussion for this week when it comes to the nursing informatics. So yours truly will have the asynchronous session, the self-assessment exercise are available, and it is already integrated in our Neo LMS course. So again, thank you very much, and keep posted on some of the announcement. Thank you very much.